Good morning. Welcome to day 74, Quantum's Liberty, DeStress Countdown, and Immune Boost. Hey, go birdies. Hope this day's finding you well. Today, on the phone with us, we have Roxy. And Roxy is a 12-year-old. Morning, dear. She's from Boston, and her mom works in the Brigham and Women's Hospital in critical care. She's a nurse. So today, what we're talking about on the phone is a bit of overwhelm that, and the little puppy's trying, he wants to be in on this. We're talking about a little bit of overwhelm, or a lot of overwhelm, that Roxy's mom and other nurses are having. And it's related to the pandemic, and it's a long haul, not only for patients, let's start tapping, but also for the nurses and doctors and frontline workers who are all over this country and the planet taking care of people who are in distress from coronavirus. And so it's literally brought the whole world to its knees, and we really need to be respectful of the amount of work that these healthcare teams are doing on the front lines. They've been battling this for 9 months. And so the new restrictions that are going to be placed need to be adhered to so that we have enough nurses and doctors and other healthcare workers, our CNAs, our medical assistants, everybody on the front lines needs to have that respect from all of us to be able to continue working. So something that Roxy was talking about, keep on tapping, is that the volume of stress that her mom is under is just making it a little challenging for them at their home. So we're going to tap on this is a DeStress series, so we're tapping to lower cortisol levels, raise our immunoglobulin levels, and these are proven by science to be effective with 1 week of tapping and meditation. So, but we're going to tap on some of the news because the news can be overwhelming. But it's important to be able to take in the news and do the next best thing, and that's what tapping does, is it taps on the trauma and the stress that might be coming into your heart, into your beingness, and changing and affecting your health. So to provide that lowered stress level, we're doing the tapping meditation for 16 weeks. It's a countdown, and today's day 74. So we'll talk first. I want to thank you, Roxy, for bringing this up, and thanks to your mom for working at the Brigham and Women's Hospital in Boston, Massachusetts. So there are several health officials who are talking about the science behind what's happening with COVID cases and deaths. So for every 100 cases, they're finding there's 1.7 deaths in the United States, and that the number of deaths increased on Thursday or Wednesday to 2,760 every single day. So we're going up. And also the number of hospitalizations is also over 100,000, which is more than double what it was from November 1. So when we have numbers like this is the time when we really need to know that our healthcare system, even though we can build more hospitals and we can build more beds, there just are not the nurses that are needed, and the doctors and anesthesiologists and people who intubate, respiratory therapists, all of those people in the health system. There's not enough to take care of just adding beds. That can't be done. So we have to do our part on the other side of the healthcare system, but is also part of it, and that is to wear masks, like the public health officials are saying. The CDC is saying that this is going to be the worst public health problem that the United States has ever had. We've already beat the flu for 1918, so we are entering into, because of all the traveling that happened over Thanksgiving, over 1 million people went on airplanes on Sunday before Thanksgiving, and so that number of people traveling when it was recommended not to travel. And I also understand that the media, the regulatory and the fiscal partners are not correlating well with each other quite yet. So once we get everybody on the same page as science, then there will be a better understanding of why we need to wear masks outside, why we need to stay home and limit contact with other people so that we can limit the spread. And by doing that, we can reduce the number of ICU admissions and hospitalizations. And most importantly, we can keep our healthcare teams healthy and not put them in the position where they have to choose who lives and who does not live, which is a very real possibility, according to 3 health officials. Leora Horowitz is Associate Professor of Population Health and Medicine at NYU Grossman School of Medicine. And she says it's terrible that we're going through this incredible surge because it was avoidable. Had we been wearing masks and been not meeting with so many people outside of our homes and been following the regulatory systems of science, which we know that we are going to be adhering to when the Biden-elect team comes in. There's several people on the coronavirus task force who are already talking about having 100 days of wearing masks at all times. That will help reduce transmission. And also Governor Newsom here in California is starting a limited stay-at-home process where we'll be able to reduce the number of people going into hospitals and hospital admissions just by reducing the contact and the transmission of the virus through wearing masks, washing hands, and also socially distancing and keeping it a stay-at-home order. So Dr. Jeremy Faust, keep on tapping, he's an MD at the emergency room Brigham and Women's Hospital in Boston, and he says the concentration of cases are going from elderly into a younger and healthier population, and that Dr. Ashish Shah, the Dean of Brown University School of Public Health, says that we do have a much worse situation because things are not shut down. So that's the reason why Governor Newsom is starting this shutdown as soon as hospitals, and I think it's not early enough, as soon as they get to 85% capacity. I think that's way too long to wait. We ought to do it now, but it seems like it's a good enough thing because it's going to happen pretty soon. Cases and hospitalizations are going up very rapidly. So let's just tap on all of that. We know that we want to tap on having vibrant health and also to reduce the stress levels in our environment we tap on stressors and traumas, and that helps us to release those traumas and any feelings of resistance to having beautiful, radiant health. So we'll tap on any resistance to having that image of beautiful, radiant health when we envision it. And then we'll tap on deserving that radiant health, and then we will tap on integrating that image into into our lives and being that radiant, healthy person. So we know from tapping research that the tapping does reduce cortisol levels 37% in 1 week, and also raises our immunoglobulin levels 113% in 1 week of tapping and meditation. So we're going to tap. And the first thing we'll tap on is any resistance that we have to radiant health. So right now, close your eyes and take a nice deep breath in and out. And we're going to do 3 rounds of tapping. In just a moment, we're going to do 3 rounds. Put your thumb on your nostril here and exhale through this nostril. And now inhale. Now take your ring finger and occlude the other nostril and breathe out through this one. Then breathe in. Now occlude the left nostril with your thumb and breathe out. And breathe in. Ring finger on the left nostril, breathe out through the right nostril. And breathe in. Thumb on the left nostril, occluding, and breathe out through the right nostril. And breathe in. That's called alternate nose breathing, Nadishadana. Leslie Tierra and Michael Tierra taught me that from East West Clinic of Acupuncture and Holistic Medicine. And so you can use that if you feel a little stress. That will help to bring down and tone your nervous system. So now we're going to tap 3 times. We'll do a setup statement. And what that is, we put the problem in a box, right? We name it. The problem is stress from misinformation, maybe, or stress from pandemic fatigue, just having to deal with like more restrictions, all right? But we'll name it inside of us, and we'll name it stress. We'll tap on it. So you put the problem in a box, and you tap on that problem, and then at the other end of the problem, you put, I deeply and completely love and accept myself exactly as I am. And that's what the 3 setup statements are. And this is transformative because in the tapping on this point right here, while you're naming the stressor, what's happening when you're tapping on this point, the karate chop point, and you can go like that, then this point is slowing down the neuron firing to the amygdala, which is our fight flight, which sends oxygen to our arms and legs to run from the saber-toothed tiger. And this is great for the caveman brain. But now we have many, many, many stressors that can come in just a second, less than a second. Our brain already senses that this is a trigger. And it's another 14 seconds before we realize that we've been triggered. But we can tap on when we know that we're coming into maybe reading the news, we can tap on this stressor. So we'll tap on this, and right now I'm going to have you close your eyes and imagine yourself in radiant, beautiful, perfect health. So Roxy loves to skateboard. You can just imagine yourself skateboarding with your friends in radiant health and having a great time, running, skipping, playing, swimming. She loves to swim. And we'll also, now that we have that vision, I want you to focus in on any part of your body that says, no, I cannot have that radiant health. Is there anything inside of you, just a little bit of an energetic shift anywhere in your body? And it could present as pain, or it could present as like a tightness, anywhere that is. So Roxy says her shoulders are feeling a little tight in her neck. So we'll focus in on that. And now give it a number from 0 to 10. If 10's being the highest amount of stress you could ever have, and 0 is no stress at all. And I'm totally that vision of radiant health there. So name that number, and I want you to just write it down, and then afterwards write it down in the air, and then afterwards just write down the place and the number, and we're going to compare it afterwards. Open your eyes, a nice deep breath in and out, and repeat after me. Even though I have this stress related to the news, I deeply and completely love and accept myself exactly as I am. Even though I have this stress from the news that makes me exhausted and rather scared, I deeply and completely love and honor, forgive and trust, and accept myself exactly as I am. Even though I'm feeling overwhelmed and sadness from the news, I deeply and completely love and accept myself exactly as I am. This news, this overwhelm from the news, under the eye, this absolutely overwhelming information, under the nose, this misinformation, chin, who's telling the truth, collarbone, what really needs to be done here, under the arm, I think I can trust the healthcare system, top of the head, they're the ones that are treating everybody. Inside the eyebrow point, they're the ones that have to do the work, outside the eye, of protecting themselves, under the eye, so that they can help others, under the nose. It's completely avoidable, chin, to enter into a situation, collarbone, where healthcare workers, under the arm, have to choose who lives and who doesn't. Top of the head. We can avoid this situation, inside the eye, by wearing masks, outside the eye, at all times now, under the eye, including walking and biking outdoors, under the nose, and socially distancing, chin, and avoiding large gatherings, collarbone point, with joy, under the arm, because we know we're doing our part. Top of the head. We're in this together. Inside the eye. And we can prove Leora Horowitz wrong. Out of the eye. Leora said, the situation is terrible because it's avoidable. Under the eye. Meaning traveling at Thanksgiving. Under the nose. We can do our part now. Chin. With correct data from the healthcare field. Collarbone. And do our part. Under the arm. I deserve radiant health. Top of the head. I walk in radiant health. Inside the eye. I give myself, outside the eye, in the way that benefits, under the eye, my community, under the nose, both locally, chin, and globally. I am that person. I'm walking in radiant health. I talk with radiant health. I am that person in radiant health in mind, body, and spirit. Thanks, Roxy, for being here and raising this to our awareness. And be well.